Okay, good morning, good afternoon, and good evening, wherever in the world you might be joining us from. My name is Safwan Masri. I am Executive Vice President for Global Centers and Global Development at Columbia University. Our webinar today, The Great Vaccine Race, Perspectives from Brazil and the World, is part of a unique initiative by Columbia University and the Global Centers to offer programming resources and support to our international students during this unprecedented time. The topic, however, is relevant to all of us, students and non-students alike. The latest news regarding vaccine development have brought some hope, a scarce commodity since the onset of the COVID-19 pandemic. US research efforts succeeded in bringing to market at least 2 vaccines produced with the latest technology and proven to be effective against the virus. Other vaccines produced in the UK, China, and Russia are already in widespread use. A number of other vaccines, including one from Johnson & Johnson, will soon be introduced into the global supply chain. Confidence is on the rise that the worst days of this pandemic could soon be behind us. While we have reason to celebrate these latest developments on the vaccine front, questions of daunting immunization logistics and glaring global inequities in access to the vaccine weigh heavily on our hopes for a balanced global recovery. Moreover, dangerous new virus strains have appeared in South Africa, the UK, and Brazil, each of these potentially undermining the effectiveness of the current generation of vaccines. Focused on the science of vaccine development, governments worldwide failed to plan adequately for the vaccine rollout phase, currently underway in fits and starts. The program has been dogged by logistical challenges, including limited vaccine production capacity and the need for expensive refrigeration equipment for the 2 leading vaccines. Global inequities in vaccine access are glaring, with the wealthier countries rushing to purchase vaccine supplies, leaving the middle income and poorer countries of the world to fend for themselves. Countries representing 16% of the world's population have purchased 60% of the global vaccine supply, and they stand ready with their financial resources to increase this share. Just look at the situation in Israel-Palestine, where Israel has led the way in vaccinating its population and is sitting on huge quantities of vaccines that it had overordered, while 5 million Palestinians under occupation, many of whom work or study in Israel, do not have access to vaccines. Finally, as if these problems were not enough, many countries have had woefully inadequate public health policies. In the US and elsewhere, governments unwilling to bear the political costs of lockdowns and similar preventive measures resorted to minimizing the health risks of the COVID-19 virus, even spreading misinformation about spurious vaccine treatments and deliberately undermining public confidence in the new vaccines. Today's webinar proposes to take on some of these big issues in the race for the vaccine by addressing the science and practicality of the rollout. We are pleased to welcome some of Columbia University's leading experts on global dimensions of the virus to enlighten and instruct us. Subsequently, our guest this morning will turn to the perplexing case of Brazil. Despite Brazil's well-regarded public health services and admirable scientific institutions, the country has suffered from COVID-19 in disproportionate measures. Thus far, close to 250,000 Brazilians have died from COVID. This tragic toll surpasses every country except that of the United States, and new cases remain at near record levels. Hospital systems are completely overwhelmed in the worst hit urban areas. And all major cities in Brazil are ringed by sprawling favela communities where the virus has been particularly devastating. But COVID is not only an urban problem in Brazil. The more remote regions of the country have been badly battered as well. It is difficult to fathom how this came to be the state of affairs in a middle income nation with an otherwise functional public health system. Our hope is that a comprehensive understanding of the Brazilian experience will help illuminate and perhaps ameliorate the problems facing other middle and low income countries around the world, particularly with respect to disastrous public policies and global inequities in access to the new vaccines. Here this morning to help us address these issues from global perspectives and from the viewpoint of Brazil are a number of noted experts, including today's moderator, Dr. Julie Kornfeld. Professor Kornfeld is Vice Provost for Academic Programs and Associate Professor of Epidemiology at Columbia University's Mailman School of Public Health. Julie is an expert in pedagogic innovations and professional training for public health leaders. Prior to her work with Columbia University, she served as Assistant Dean of Public Health at the University of Miami Miller School of Medicine, where she launched the nation's largest integrated four-year dual degree in medicine and public health, a program that gives graduate physicians the skills to solve the complex problems facing local and global communities. Julie, it is with pleasure that I turn it over to you to introduce our wonderful panelists and to get the conversation going. Thank you.
Thank you, Safwan. Very great introduction and very excited to jump into the presentation. So our format for today, Dr. El Sadir, who's a university professor of epidemiology and medicine here at Columbia and the founder and director of ICAP, will begin and give us a big, an overview of the global vaccine development and distribution. And then we're going to turn to our three panelists with deep expertise in Brazil. And they will each give a commentary based to follow Dr. El Sadir's presentation. I'll turn to each of you after Dr. El Sadir's presentation. And then we will have question and answers. So I encourage our audience and our participants, please go ahead and post your questions in the Q&A and we will answer them as we have time at the end of the presentation. So I'm going to turn this over to Dr. El Sadir and then I will come back and turn to our panelists.
Well, thank you very much, Safwan, and thank you, Julie, and bon dia, everybody. Let me share my screen. Can you see the screen, Julie? Okay. So I'm going to do a very brief update on the COVID-19 vaccine and a bit of touching on some of the important issues relating to the vaccine itself as well as to vaccination programs. So just to start, I think to give you a snapshot of where we are in terms of the global pandemic, there now have been reported more than 111 million confirmed cases of COVID-19, and this is a way underestimate because, as you are well aware, testing for COVID is not widely available in some countries, and more than 2.4 million people have died from COVID-19. Just yesterday, the US reached 500,000 deaths from COVID-19. Now, when we look at by region, what's interesting is that the vast majority of cases that have been reported thus far have been reported from the Americas, North America, and South America, as well as from the European region. And then if you look at this map on the right-hand side of your screen, you'll see that COVID-19 has really touched every country in the world. But the top 5 reporting countries include the US, followed by India, Brazil, Russia, and the United Kingdom. And this has been the order of, for the past several months. And actually for many, many months, the US has been leading in terms of reporting the largest numbers of COVID-19 cases. Now, what's important about the virus? The epidemic has been evolving over the past several months, now almost a year. And as the virus multiplies and is transmitted and multiplies, these kinds of viruses, the coronaviruses, and this virus particularly, SARS-CoV-2, makes mistakes as it multiplies. And as it makes these mistakes, it creates what we call mutations. And these mutations create what we call new virus variants. So for example, you can see in this figure here, that some of these mutations, some of these errors as the virus is multiplying result in changes in the spike protein up here, the top part of the virus. And this is the part of the virus that latches onto the receptor in our bodies. So as these changes happen in this protein, this can influence a lot of different things. It can influence how transmissible the virus is. It can also influence potentially how deadly the virus is, and may also influence in terms of the ability of the virus to outsmart our treatments and vaccines. You are probably aware there's several variants that have been very prominent in the media of concern. The one isolated from the United Kingdom, the one from South Africa, the one from Brazil, and there's several variants that have been isolated in the United States as well. So let's move on to a vaccine update. The good news is that there's a very robust pipeline in terms of vaccine development. And we know that there are now about 37 different vaccine candidates that are in phase 1 of research. And phase 1 is the very first test in humans. And this is largely to determine whether this vaccine candidate is safe. There are 28 candidates now that are in phase 2. These are larger studies to determine largely the safety of these vaccine candidates. There are 20 in phase 3, and this is the final phase, large studies that determine whether the vaccine actually works and whether it is safe in large numbers of individuals. Based on these studies, we have 4 vaccines that have been fully approved for use. Now, here is a list of the status of leading vaccines. You can see that we are very fortunate, and there's several vaccines now that are available in various parts of the world. In the US, the Pfizer-BioNTech and the Moderna vaccines are the ones that are in use now, and these use a technology called the mRNA technology, a new technology for production of vaccines. But there's several other vaccines, the Jamalaya, Sputnik 5 from Russia, the Oxford AstraZeneca, and 2 vaccines made in China, as well as Johnson & Johnson, Novovax. So the good news is there are several vaccines either that have been approved or on their way to approval or in large studies, and also that they work through different ways. They're produced in different ways, which is good, which means that some individuals, for example, who may not be able to tolerate one kind of vaccine can receive a different type of vaccine. I'm going to walk quickly through the vaccines that are most prominently available. I'll start with the Pfizer-BioNTech and the Moderna vaccines, and they're very similar. They're both mRNA vaccines, like I mentioned. They're highly effective in these phase 3 studies. They were shown to be 95% and 94% effective, which is very, very good news. There also have not been any serious safety concerns that have been reported. Most commonly, the side effects have been local at the injection site and mild to moderate. None have been severe. And both of these require 2 doses for vaccination. Now, I've highlighted here in yellow some of the concerns with these new variants. So you can see that in experiments in the laboratory, that there's a lowering in the amount of antibodies. This is produced by the immune system in the body, a lowering of the amount of protective antibodies against the South Africa variants by 6 times, and also a 2-fold decrease against the UK variant. Similar findings were also noted with the Moderna vaccine as well. Although, even though this has been noted in the laboratory, it is believed that probably the antibody levels may remain protective against these virus variants. Now, 2 other vaccines that are important are the Johnson & Johnson Yansen vaccine, and this is the only vaccine thus far that's been developed that actually uses only 1 dose. So that's really important from a practical perspective. This vaccine has been studied in various parts of the world in large study of 44,000 people. And what it showed is 72% efficacy in the United States, 66% in Latin America, and 54% in South Africa. And it's been shown, though, across the board that it appears to be protective against severe COVID-19 disease. Now, the Oxford AstraZeneca vaccine has also have been shown to be overall about 70% effective, but you can see a gradient in efficacy, 90% in the UK, about 62% in a study in Brazil, and only 10% efficacy against the South Africa variant. So you're seeing a trend here that these vaccines appear to be, based on these studies, to be less effective against the South Africa variant in particular. The good news, again, no serious side effects with either of these vaccines, apart from the mild to moderate ones that I mentioned before. There are also other vaccines, another one called Novovax, also studied in large numbers, 15,000 individuals with about 4,400 in South Africa. And again, the same phenomenon of 89% efficacy in the United Kingdom, but 49% efficacy in South Africa. And again, no serious side effects. Now, the Sputnik V vaccine produced in Russia has also published results, highly effective at 94% with no serious side effects and requiring 2 doses. And lastly, I'll touch base on the 2 vaccines that are produced in China, because I believe that Brazil is also using the Cyanovac vaccine. And these use inactivated virus as a way of producing the vaccine. And again, you can see the efficacy here between 79 and 86% for Sinopharm, and between 50 to 78% with Sinovac. And again, importantly, no serious side effects have been noted with either of these, and both of them require 2 doses. So the trend we're seeing is that these appear to be safe vaccines. The efficacy varies from one vaccine to the next, and we appear to be seeing a gradient, a consistent gradient, with the studies that have been done more recently, where they've been studied against the South Africa variant, with some compromise of the efficacy of these vaccines against that variant. So let's talk about vaccine equity now. So this is what's been known for a while now, is the disparity in terms of the purchasing or securing of doses of the vaccine by country and entity. You can see here again, this is numbers of doses of the vaccine here on the y-axis, and some of the country and the entity names on the this is x-axis on the y-axis. You can see that the European Union, for example, has secured large numbers of doses, initial doses, followed by the US. COVAX is an initiative between the Gavi and WHO with the goal of providing vaccines or purchasing and procuring vaccines for low middle income countries. And the African Union has also been engaged as well in securing or attempting to secure vaccines for African countries. And then you can see that the majority of the to a much lesser extent, other countries have been working on trying to secure some of these vaccines. And you can see here Brazil right here, again with the Moderna Pfizer vaccine, AstraZeneca vaccine, as well as other vaccines that have been ordered by the country. And then you can see, of course, there's a very big disparity that's been noted, and you can see in these colors here that the high-income countries, again, in the biggest bar here in terms of the numbers of doses that have been purchased by high-income countries versus upper middle income, lower middle income, and low-income countries, and then by COVAX, you can see here in the gray. So we are beginning to see this disparity noted between different countries, different regions of the world in terms of access to the vaccine itself. And then in terms now, let's beyond the purchasing and procurement of the vaccine, of course, the most important thing is next step is vaccinating people. It's very important to have vaccines, but ultimately vaccines don't do anyone any good sitting in freezers or refrigerators. It is the vaccination program. It's getting the vaccines into the arms of people who need to be vaccinated that matters the most. And this map shows the global vaccination per 100 persons. And you can see again, similar to what I mentioned before, is that the darkest blue are countries that have the highest rates of vaccination per 100 person. And again, you can see the darkest blue, the United States, and Western Europe as 2 examples, and then other countries with lighter colors of blue. But of course, there's a glaring disparity that's immediately notable, which is of course the continent of Africa, where very few, if any, people have been vaccinated thus far. There's the beginning of some vaccination in South Africa for healthcare workers, but that's about it. And then on the right-hand side, you see also the rates of vaccinations, again, per 100 persons. And as was mentioned by Safwan, Israel has been leading in terms of vaccinating some of its populations, followed by the UAE, the UK, the United States, and other countries here, as you can see in the list. And you can see Brazil here at 3.27 vaccinations per 100 individuals. Now, what about vaccination intentions and impact? I always say that whatever you have, any intervention, whether it be a medicine or a vaccine, in order to achieve the desired impact from this vaccine, in this context, we're talking about vaccines, you need two things. You need efficacy, you need something that works well. And we're very fortunate to have some of these vaccines are very highly efficacious. That's really important. That's a very important prerequisite. But another prerequisite is coverage or uptake, which means the number of people who have received the vaccine. And that's really important. We are not going to achieve the impact of these vaccines without achieving sufficient uptake and coverage by these vaccines. And it's important to also realize it's not just the total number of people to be vaccinated, but who gets vaccinated. Because from a public health perspective, you need to vaccinate the people most at risk, most vulnerable, where there's most of the transmission happening. They need to be vaccinated first so you can actually decrease the transmission of the virus. As well as, of course, in order to protect people at higher risk of complications of COVID-19. So coverage is very critical, but also equity in coverage is very critical because you want to reach those who are most vulnerable to infection and those who are most vulnerable to complications first. But ultimately, we want to achieve the highest possible coverage with efficacious vaccine in order for us to achieve population immunity or the impact of these vaccines. Now, there is a continuum in terms of vaccine acceptance, and this is a topic that has received a lot of attention. And this is the continuum. You have on one end people who are convinced that if asked the question, if we had a vaccine, if you were offered a vaccine today, would you take it? And these are the people on this end of the continuum who say absolutely. And what we need to do is for individuals who are poised to act is to make it as simple, as easy as possible to get vaccinated. We have to make it to do away with all the barriers, linguistic barriers, cultural barriers, geographic barriers, economic barriers. We have to really try to address all of these so that we can get people vaccinated as soon as possible. And then in the other end, there are people refusing. These are people who refuse vaccines. They may not believe in vaccines at all. And these are the anti-vaxxers, have been called anti-vaxxers. But I think most people really often sit in the middle here. They are taking this wait and see approach. And it is our incumbent among all of us who are engaged in public health and so on, and health overall, is to provide the answers to these individuals, to provide the answers to their questions, to their concerns, to identify the champions from their communities so that they can talk to them in a trusted manner and gain their trust so that they feel comfortable, they feel that they are ready to act, they're moving down on this continuum and they're ready to act. So we have to tailor our intervention based on where people are at in terms of vaccine acceptance. You can see here on the right a survey that was done, and this survey asked the percent who agree or disagree, agree is in green, disagree is red, that they would take COVID-19 vaccine if it was available. And you can see that Brazil is very good, in a very good spot. So that's really good news, is that most people, when asked these questions, they agree is that they would go and get the vaccine. But you can see the variability in different countries here across the world and point out Brazil at the top with 86% agree. And then down here, the United States with only 63% agree with doing so. I think what's important is to notice what's here on this side of the figure, which is the change since December. We've noticed, thankfully, a change and an increase in acceptance of vaccines over the past several months. And you can see here across the board, there's been an increase, although for some reason in this survey, there was a decrease in the United States and a tiny decrease in South Africa. But nonetheless, it's encouraging to see that people are more willing to accept vaccines. So our task is really to make it as convenient as possible for those who are ready to get vaccinated. And then for those who want more information, need somebody they trust to tell them about vaccines, to work very hard to make that feasible for them. So I say that at this point in time, we're in a race between this virus and the vaccines. It's a very important moment. There's great, I think it's a moment of great optimism. I always say that There's a light at the end of the tunnel. You know, the light is at the end of the tunnel, but we still have to walk through that tunnel to get to the light. And as we're walking through that tunnel, it behooves us to do two things: to do everything possible to decrease transmission of the virus, as well as to, of course, scale up vaccines. So, like I said, there's good news in terms of the decrease in numbers of cases in the United States that's been noted recently, the decrease in the UK, the decrease in Europe, in Brazil, in other countries, even in South Africa, a decrease in numbers of cases. But at the same time, there's the concern about the evolution of these variants. So we have to try to stop every single transmission, because every time the virus is transmitted and multiplies, it is going to make those errors. It is going to create new mutations. So in conclusion, pandemic continues to grow and evolve. Vaccine development is moving along at a rapid pace, but there is the need to expand vaccination reach within countries. There are inequities within countries, as well as inequities between countries. And that applies to the United States, and I'm sure it also applies to Brazil as well. And I'm sure we'll talk about them. As the virus is transmitted and multiplies, these new variants appear, which may threaten to outsmart our vaccines and treatments. And I want to end with that, even with vaccination, we need for the foreseeable future to continue to observe the public health preventive measures we all know about, for several reasons. One of them is the evolution of these new variants. Also, that protection from the vaccine is not immediate. There's no vaccine that's 100% effective. We don't know the duration of protection from with these vaccines. We have very limited information, beginning to get information about whether the vaccine will prevent just an asymptomatic infection. All of the studies have measured prevention of disease, but not infection. There's evolution of some data to tell us that it's preventing infection, but we have to wait and see. And of course, that the vaccine efficacy may be compromised by these new variants. So I end by saying that please, when people ask me what they should do the day after they get vaccinated versus the day before they get vaccinated, I always tell them, you continue to do exactly the same thing until we can walk through that tunnel and get to the end of the tunnel and hopefully the end of this pandemic. Thank you very much, and I'll stop here.
Thank you so much, Wafa, for an amazing presentation and a really comprehensive overview. We're going to turn our conversation a bit to Brazil, and I'm going to turn first to Miguel Lago, who is the Executive Director for the Institute for Health Policy in Rio. And Miguel, maybe you can help us to understand the situation perhaps in Brazil and maybe more broadly in Latin America. We know the region is experiencing significant impact, yet seeing little availability of vaccine. So perhaps you can orient us a bit.
With pleasure, Judy. Well, first of all, thank you so much for the opportunity to be here in this such amazing discussion. Unfortunately, I will need to leave a little bit earlier because I have my students at Columbia waiting for me in about half an hour. But I'm very, very glad to be here and listening to this amazing presentation. Thank you so much. So if we look to Latin America, one of my major, I think the major challenge we have in Latin America is that inequality is challenging immunization. So if you look at the region, so 25% of the death tolls from COVID in the region where only 8% of the population lives. So it has been extremely impacted by this pandemic more than other regions in the world. And inequality has been one of the major reasons for this to happen. I think Latin America, when we look at the countries, and of course, there's a lot of diversity inside and within Latin America. However, if we look at we have three constant traps in Latin America, not always present in every country, but certainly the one that is completely across all the nations is structural inequality. So the first trap, I think, it's structural inequality. The second one is the fragility of health system, which is not the case of Brazil, but it's the case of many of our Latin American countries. And finally, poor leadership, which is the case in Brazil. So if we look, for instance, Peru, who is a country that took it really seriously in March last year. They did a lockdown very quickly. They took it really, really serious, much more than European countries. But Peru had a very fragile health system, no state capacity to really afford paying for people to stay at home. So at the end, 1 year after, you can see that Peru had a really hard time. Brazil also had a hard time. Brazil had the state capacity to pay for people to stay at home. Brazil had the state capacity of having a strong health system that could have been used, but it had a poor leadership that was fighting any kind of rational or scientific measure only for electoral reasons. So when the country has a good leadership and a serious leadership, it gets trapped because of inequalities and the fragmented health systems. When it has more solid health systems, what we have seen is that leadership has simply destroyed this capacity. So going further, I think that looking at the vaccination, we still have the same kind of problems. Because of our fragile health systems, we don't have the capacity to develop those vaccines in our countries. Of course, Brazil is an exception when we are looking to the whole region. But still, Brazil's capacity has been challenged for the last year. So this is the first issue. So we're very dependent on COVAX, which is the multilateral commitment to have vaccines for every citizen. The problem with COVAX is that the way that it's distributed, it's 3% of the population, of the general population of each country. So for instance, a country like New Zealand has the same amount of vaccines as a country as Costa Rica. So when Costa Rica was had an outbreak much more serious than New Zealand, and has not the same state capacity and the same conditions as New Zealand, as we all know. So the first challenge that I see here for Latin America is that we should absolutely have a fair priority model in order to have a distributed justice around the COVAX. But Latin American countries that are dependent on COVAX, they need to coordinate themselves, and they need to advocate for a fairer distribution together. And we don't see any country leading this situation. So then we have the poor leadership here again. And the second challenge that I see is also when looking at the vaccination plans. So when we look at them, we see when we look who are the priority populations to be vaccinated, we feel as we are in Europe or in the United States. So we're copying the same model of Europe or the United States when we know that we have other facts, we have other risks for populations in those countries. So we know that inequality has been a great ally of the virus in Latin America, and we need to include a socioeconomic criteria also in the priorities the priority orders and the queue for the vaccination. It's absolutely necessary. We cannot. It's not the same situation in Europe, but it's the situation in Latin America. So we should definitely embrace this as a criteria. So I'm advocating that in just summing up, that we need a regional coordination in order to advocate for a fair priority model as a region, as a whole region, so that we have a more equitable COVAX distribution around the world. First, the second measure is that we absolutely need to adopt the same logics, the same equity logics inside our countries in the moment when we vaccinate the people. So, and we're not seeing this happen. So this is something very important also to advocate for. But I'm just, this was my main message, and I'm happy to hear all my amazing co-participants to the discussion. Thank you.
Thank you so much, Miguel. I'm going to turn next to Dr. Sylvia Martin, who's a professor of epidemiology here at Columbia at the Mailman School of Public Health. Um, Sylvia, Miguel talked a bit about inequity. Maybe you can talk a bit about vaccine prioritization within Brazil and approval processes within Brazil. You know, how is it that what are in the US and in Europe, we have seen very much a focus on vaccinating the elderly and those in nursing homes. I think Miguel made a case for the fact that inequities might justify different prioritization. And maybe you can speak to that and a bit about approval access within Brazil.
Well, thank you, Julie. Thank you for inviting me to participate today. So in regards to the vaccination process in Brazil, as Miguel said, Brazil has the capacity and the infrastructure. Brazil has a strong public healthcare system, and the problems that are arising now are mainly due to lack of leadership. So Brazil has been offered ever since July of last year to make agreements with several different pharmaceutical companies, but because of lack of leadership, it ended up like only negotiating to get access to the vaccines that can later be produced in the country. So that is the Chinese vaccine Sinopharm Coronavac, which at first it was a state of Sao Paulo that was able to make the negotiations and make that a reality, and only later on the federal government agreed to buy it. And then also the AstraZeneca Oxford vaccine that still has just recently, the product has recently arrived in the country. So basically Brazil is relying on those two vaccines. The approval, they have been approved for emergency vaccination, and the approval process is relatively lengthy. So Brazil's FDA and Visa ask for a lot of details. They have recently changed some of the requirements. So initially they wanted like clinical trials conducted in the country and specific data from clinical trials conducted in Brazil, which was also a hurdle. I just saw earlier today in the news that they just approved the Pfizer vaccine. They just approved the Pfizer vaccine earlier today through regular approval, but it's still unknown whether the government is going to have an agreement that is going to have access to the Pfizer vaccine, especially because it has already been distributed and sold like to many other countries. So I would imagine Brazil would be way back in the line to get some of those vaccines. And then the matter of prioritization. So Brazil started its vaccination program about a month ago, so on January 17th in the state of Sao Paulo with a Sinopharm vaccine. To date, they have vaccinated about 7.25 million people. They have used like 7.25 million doses. Almost 6 million people have already been fully vaccinated. Almost 6 million people have already received one dose. About 1.3 million people have been fully vaccinated, but it has prioritized mainly healthcare workers and the elderly. The elderly, and really, like in most places, it's mainly people 85 and older that have received the vaccine. That have received the vaccine. Some capitals, depending on how much vaccine they have received, have vaccinated older people, but slightly elderly, but slightly younger. They also have prioritized vaccinating the indigenous population and quilombolas populations, where people that are descendants from enslaved people that live in separate groups. But there has been very little discussion about like, let's put in the priority groups like essential workers. So for example, people working in grocery stores, or bus drivers, construction workers. So people that are regularly in face-to-face with the public. And also we know that as in the US, like in Brazil, people from low socioeconomic status have been harder hit by the virus, and there is yet no prioritization for that. I know there has been some discussion of including also school teachers, as priorities, and that might be a reality from March onwards. But it's still something in flux and under discussion. So most of the kids in Brazil have been out due to the virus, have been out of school ever since March. And then there's also an inequity in that as of now, like a lot of private schools are going back like to a hybrid model, but in the public schools that is not happening. And I think that accelerating vaccination to teachers would help with that. So I think there needs to be more discussion, and that is also mainly due to lack of leadership at the federal level and clashes between leadership at the federal, the state, and the municipal level. Brazil has the capacity to vaccinate more than 1 million people per day if they want to do it. It has like all the infrastructure. It has the infrastructure once vaccines are available and once vaccines are produced locally. So we know that Instituto Butantan will be able to start producing locally the Sinopharm Coronavac vaccine after July, so between August and September. But there are still several months for that, and there are new variants. There are new variants going around the country. So if things had been planned earlier, I think Brazil would be in a better position nowadays. Yeah.
Thank you so much. I'm going to turn now to Dr. Rodrigo Soares, who is a Lehman Professor of Brazil Public Policy here at the School of International Public Affairs at Columbia University. Rodrigo, I think Dr. Martin spoke a bit about the National Health Service and the infrastructure, but perhaps you can talk a little bit more about the tension, particularly between federal and state and municipalities, and how that's impacted the vaccination plan across the country. Certainly, we have seen that tension here in the U.S., but I think it is playing out differently in Brazil, in a country that has a long and successful history of vaccination, particularly around H1N1. So I'll turn to you to see if you can lend us some more insight there.
Thank you, Julie, and thank you, Tom, for the invitation. It's great to be here. So I'm going to try to address some of the points that Julie made. I'm going to get back to some of the points that the other speakers touched upon as well. So let me just, start with a slightly broader perspective. I think it's obvious from the news and from things that we've already discussed here that the federal government in Brazil has done a very serious harm to the response to the crisis, right? Part of it intentionally for ideological and political motivations, but I think also part of it out of just sheer incompetence, right? So I think there is the lack of management capabilities at the top of the Ministry of Health is really staggering, right? So lack of initiative, lack of planning capacity. So there's no doubt that the response at the country level has been much worse than it could have been. Having said that, I think we have also to put things in perspective, right? I understand and I know it's very difficult to make comparisons across locations before the pandemic has actually ran its course in different places in the different countries. At the same time, just to look at the aggregate numbers at the country level, doesn't carry much meaning either, right? Because countries are of different sizes. So if you look today, in per capita terms, for instance, mortality in Brazil is still way below most of Western Europe, way below the US and Mexico, for instance, and not very different from Argentina, Chile, and Colombia, right? So again, I think there's still a lot to play out. There is the fear of what the Brazilian variant is gonna do in the country. There are issues of age composition differences across Brazil and the European Union. We really won't know how this is gonna be until the end. But the fact that Brazil is not really an outlier right now in terms of outcomes of the crisis. I think that the point is that Brazil could have been very likely a positive outlier in terms of having had a very good response as the country had during the HIV/AIDS crisis, right? So this didn't happen either, unfortunately, and I think obviously the government's very much to blame. But at the same time, it's not really an outlier right now when we look at outcomes, right? So in some sense, I think this reflects the fact that the actual response in the country is not really what's portrayed in the president's speech or in the ministers of health's speech, right? And I think this indeed has a lot to do with the unified health system that we've been talking about, right? So I think that despite everything, despite the major political efforts at the country level to slow down the response, the system actually functions organic a little bit by itself, right? And obviously it could have been better, but it actually has done a lot by itself despite the negative influence at the federal level, right? And I think this is true of the network of family health clinics, of the exchange of information that is actually built into the system. This is true of the research institutes like Oswaldo Cruz and Butantan. And this has all happened, I mean, let's say beneath the outrageous claims that we hear from our leaders, right? And something that has happened, and we have already alluded to that as well, is that local governments, in particular states, actually have assumed a protagonist role in terms of the strategic planning of the response at the country level that is really unprecedented in previous crises in the country. Like usually we would have seen the federal government taking a leadership role, and obviously this was not the case. And I mean, I wonder whether this will have political implications in the future for Brazil in terms of really redefining the federalism and the relationship between the different political actors at the country level. And I think, I mean, getting to the vaccination specifically, I think the vaccination is yet another manifestation of this overall story, right? There was complete inaction and lack of planning at the federal level, a stalling of the vaccination program, no initiative whatsoever, lack of understanding of the need for the diversification in terms of looking for different vaccines and knowing that scarcity would be an issue in the future. Overall, just kind of a very much a lack of the sense of urgency, right? And again, state governments, the independent public health institutes, local governments, and the private sector actually assumed this leadership role in a way that was also unprecedented. So the government, what it has done, it has been as a response to political pressure coming from these different actors, right? But again, I mean, also in relation to vaccination, I think we have to put things in perspective, right? Because I think it does highlight the merits of the health system in Brazil. The issue of vaccination has been extremely challenging, I think, for most countries, with very few exceptions. You might say Israel and the UK, certainly. Maybe you might include US and Chile, for instance, on those. But if you consider the first dose, I mean, and I have numbers that are slightly different from WAFA's numbers, but I think mine are outdated a little bit, probably a couple of days, but I think it tells more or less the same story, right? So I think this was the end of last week. Brazil had vaccinated 2.8% of the population. The average at the European Union at that day, when I checked, was actually 3.9% of the population. Argentina, Colombia, and Mexico were actually below 1%, right? And this is actually kind of surprising because Brazil started considerably later than all of these, right? And I think this goes back exactly to the same points that I mentioned before, and I think Sylvia also mentioned before, related to the capacity that is already built into the unified health system, right? And that's why I think that moving forward, I don't want to extend myself, so just to conclude, I think moving forward, I think there are some reasons to expect that Brazil will do relatively well. And when I mean relatively well, I mean in comparison to other middle-income countries, right? I think the challenges are not going to go away very, very quickly. But I think historically, Brazil has been, I mean, during the historical polio immunization campaigns, Brazil has vaccinated 10 million children a day, right, in certain circumstances. I think recurrently during the H1N1 vaccination campaigns, the country vaccinates 80 million people in 3 months, right? The system is already built, it's ready, it's operational. In some sense, you really just have to press the button, right? I think there are tens of thousands, 35, 40,000 vaccination centers that are broadly set up. So the challenge is really the access to the vaccines, right? I think also in this respect, since at least, as I understand, at least 3, because I think the Russian vaccine also is going to be produced locally, since at least 3 of these vaccines are going to be produced locally, I think there is also some chance that actually we may respond better than our peers, let's say, right? I think the issue is really scarcity, and that I think in the case of Brazil, I don't think it's in the near future, I guess, probably over the next month. It's not going to be an issue of scarcity of the vaccines themselves anymore. It's going to be an issue of the scarcity of inputs, right? Inputs for production. I try to read about that. I don't know how easier, if this actually makes life much easier or not, if the inputs are going to be as hard to find as the vaccines. But I do think that it's entirely obvious that we could be in a much better position, and that everything that the federal government has done since the beginning of the crisis has been to undermine the response. Nevertheless, I think we hopefully maybe are going to be in a decent position when we get access to inputs and are able to actually start really rolling it out, right? But I think there are lots of uncertainties. There's still the variant going around that I don't think we understand fully what's going to be the impact of that. So obviously the level of uncertainty is extremely high. So let me stop here. And thank you again for the opportunity.
Thank you so much. Really interesting points that you've all raised. I think you mentioned, Rodrigo, it's very difficult to compare countries, and I think there are difficult challenges among and between countries, as well as within countries, and so it is very difficult to look at this. But I think one thing I think the global pandemic has taught us is that none of us are safe until all of us are safe. So I guess I would turn to each of you a bit and to say, if you had to focus on, and maybe Wafa, I'll start with you from kind of a global level. If you had to, where are the solutions? Where do the solutions lie? If you had to focus on one area, there's many places to focus, but where do you think some of the solutions are? Is it within COVAX? Is it within national companies negotiating their own vaccine supply and distribution plans? Wafa, I'm going to ask you to, I think you're on mute, Wafa. Uh-oh. Okay. Technical difficulties. Okay, so maybe I'll turn back to Sylvia or Rodrigo. Maybe Sylvia, if you want to comment.
So one issue I think is that we, as Wafa has mentioned earlier, like it's not just vaccine. Vaccine is not just a magic bullet. We need to make sure that the general public keeps doing what people have been talking since early in the pandemic. Continue wearing masks, washing hands, and social distancing. So that is also another issue, that I think happens in several other countries, but happens in Brazil. Like some people think that if they just already took one dose of the vaccine, they are free to do whatever they want in their lives. Or last week was Carnival, even though most of the major events were canceled, we still see in the news people that gather together for local festivities, secret parties, people gathering together. So Brazil has been on a streak of a high number of cases for the last month or so, ever since the end of the year parties. So Christmas, New Year's, it still has more than 1,000 deaths, of COVID a day. So we really need to focus on what we already know that helps disseminate the virus. And of course, I also think rich countries should also try to help middle income and low income countries in vaccine access. Yeah. So as we saw, I think a few days ago, Biden pledged to give funds to COVAX, and Novovax is going to give more than 1 billion vaccine doses to the COVAX initiative. So I think initiatives such as these initiatives need to happen, and fast.
I'm back.
Thank you, Wafa.
Good. Apologies, technical difficulties. I do think, what's unique about this pandemic is that it really has affected all countries, and probably some of the most severely affected countries have been the high income countries, which is pretty unusual. And so if you look at a city like New York City, for example, it's been much more severely impacted than people imagine in terms of the losses and deaths and suffering and so on. And similarly, certain communities within high-income countries have been totally devastated. So it's a funny thing, because here you have a pandemic that's of course it's affected countries differentially, but it in some ways affected some of the richest countries in the worst manner possible. So it's a complex situation where obviously some of the leadership in these countries are thinking, they need to control the epidemic. They need to do something to be able to address the losses and the suffering and so on. While at the same time, we have to also think about the inequities between countries. So I think it's very complicated. And I feel like I always tell people it's a win-win, because even if no country is going to be safe by just building walls around itself. This is a virus. It's going to spread across borders. And we know viruses don't respect borders. So in a way to protect the US, let's talk about the US population, you need to protect the world population because we're all interconnected. So it's in self-interest, I guess that's what I'm trying to say. So I think that's a difficult narrative, because there's this self-interest because people have suffered, but at the same time, I think wealthy countries have a responsibility to give and support others. And like Sylvia said, there's now the beginning of recognition with a commitment by wealthy countries to COVAX. I do think it's important, though, certainly Brazil has the infrastructure to be able to do vaccination. So it's a supply issue in Brazil. To a large extent, it's a supply. And once the supply is here, hopefully the vaccination machinery can be activated and be effective, I hope, I trust. I think there are other countries in the world where it's more than just supply. And it is the investment, not just in the procurement and the supply, but it is in all of these machinery that you need, the staffing, the communication, the vehicles, the refrigerators, the freezers, the vaccination program. So each country will have very different needs, Julie, based on their own circumstances. And I also find there are lots of lessons to be learned across borders, and certainly the US has not done very well, as we all know, either in the response or in the vaccination. So we all kind of are learning from each other, and that's maybe been the silver lining with COVID-19, is that whether it be clinicians or researchers or public health people, we're learning from each other and adjusting our programming to hopefully be able to get to where we want to get to.
And identifying the lessons we want to take forward.
Yep.
Yeah. Rodrigo, did you want to make a comment? And then I have a few questions from the audience that I want.
Yeah, just complementing what Sylvia and Martha said. I think, I mean, I think the understanding that actually vaccination is not gonna solve things overnight, right? And that we have to keep at the effort of social distancing and behaving, let's say, right? And I think in the case of Brazil, I mean, in an abstract world, if I was gonna say like what would be the single issue that's relatively easy and that would have most impact, probably would be a change in the political speech, right? And I mean, there's a lot of evidence now. I think in the case of the U.S. with Trump, in the case of Brazil with Bolsonaro, serious research done showing how their speech actually indeed affected people's behavior and indeed affected the rate of transmission and rate of mortality, right? So I think this would be a cheap thing to do, obviously, but it's not within our control, right? Because obviously it's not a policy variable that we can freely choose, right? So, so in terms of actually of vaccination and the discussion of the international allocation, the problem of allocation of vaccines across the different countries, I do think the international organizations should step up and really assume a leadership role in this discussion, because obviously, as Wafa mentioned, it's very difficult for the countries to just give up right in the middle of the crisis, give up a certain share of the vaccines that they have, given the level of scarcity that we're seeing mostly everywhere, right? So I think this is the type of situation where international organizations can actually work to reinforce these international agreements, right? And I don't think they have done that really. By that I mean the World Health Organization, the World Bank, in the case of Latin American the Inter-American Development Bank, really to step up this discussion, trying to rationalize the distribution across the different countries, right? But yeah.
Thank you. There's a couple questions, I think, from the audience. I think Wafa, probably best directed to you, about what's happening in Brazil, and one about the variant, and what we know about vaccines that might protect against the P1 variant that we're seeing in Brazil. And the other, I think, also about some of it seems like there's some concerns about and vaccine hesitancy around the safety of the Chinese and Russian vaccines. And maybe you could comment on both of those things.
Yes, and I think it's really critical, to step back and reflect that, when we were thinking ahead and thinking about what kind of a vaccine would be important to have, at that time there was most researchers said if we had a vaccine that was 60% effective, that would be well worth the effort. So I think and that was the threshold that was set by the Food and Drug Administration in the US. So they wanted to look at data from any vaccine that at least achieves 60% efficacy or effectiveness. So I think that the fact that there are some vaccines that are 94% and so on effective is fantastic. But also keep in mind that these vaccines were studied at an earlier period of time when we did not have these variants. So that's really important to keep in mind. So I wonder if the Pfizer-BioNTech studies and the Moderna studies were done today, not a while ago, not last summer, but today, what would be their efficacy? Because the efficacy is dependent on, of course, the viruses that are circulating in the community. So I think you need to keep in mind that and this is like comparing apples and oranges, is when these studies were done. And the more recent studies are the ones that are facing these new variants. And that's why we see a little bit of a diminution of efficacy. Nonetheless, when people ask me, I'm being offered this vaccine. Should I take it or should I wait for whatever? I say, take it. If you're offered the vaccine, because the benefits of the vaccine far outweigh the risks. Number one, these have all been found to be safe. And number two, the benefits are so much better than the possible complications of COVID-19. I think that's the most important thing to keep in mind. I do believe that companies are now working on developing new vaccines. So they're using the same technologies and they're now developing vaccines against these new variants. Because a lot of the vaccines that are now available, they all were built on the prototype virus, which is the virus that was in Wuhan, way back in China. That was the prototype virus. Now they're taking current viruses, including these variants, and developing these new vaccines. So it's possible that in the future, after this initial vaccination, there may be the need for a booster vaccine, for example, that would be one that was created to be effective against these new variants. So science is evolving, and we're going to learn along the way. But I do think that that we should do whatever we can to encourage people to be vaccinated for the reasons that I mentioned, and try to overcome their hesitancy in a variety of different ways that probably vary from country to country and context to context.
Mm-hmm. Great, thank you. Excellent. I think I'm going to turn and see if we have other questions, but I think, Safwan, I'm going to turn to you. I want to thank our panelists. I know we lost Miguel, who had to run off and teach students, but that's more important, I think, than this. But I want to thank each of you for your time, your energy, and your constant work on this public health situation, both globally and within Brazil. And thank you for sharing your expertise. Safwan, I'm going to turn over to you to close us out.
Thank you.
Thank you.
Thank you, Julie. Thank you for leading this and for all the work that you do to try to bring some of this incredibly important knowledge to our students and to our audiences around the world. Thank you, Wafa. Thank you for always illuminating any conversation about this, and for all the great work that you do at Columbia and in the world. And Sylvia, Rodrigo, and Miguel in absentia, can't thank you enough, really, for adding to the richness of this conversation and to its texture and for bringing your expertise from Brazil. I think, it's fair to say that the road ahead is still long, and Wafa talked about the tunnel and our ability to walk into that tunnel and get to the end of it. But there's a lot to be hopeful about in Brazil and around the world. And I think there's a lot to learn and build upon. And I think we're all very fortunate to have people like yourselves doing the great work that you do. I also want to recognize and thank the Rio Global Center team, Tom Trebat and his whole team for organizing this and for making it happen. So thanks to our audience and thanks to all of you, and stay safe, stay healthy, and continue to be upbeat. Bye. Thank you.
Bye. Thank you, everybody.
Bye. Thank you.